Thank you, David. So there's 4 topics that I'd like to touch on within the report: strategy, people, innovation, and service users and carers. So strategy, you can see at the front of the document, we talk about the people plan that at a national level has been launched recently. A very sensible, common sense plan for me. Describes a variety of commitments. It's timely in that we are refreshing our strategy. I mentioned this on a couple of occasions, and that will come to our October board. So in a month's time, we will bring our internal organisational strategy that will, as you would imagine, address all of those commitments within that national people plan. So the timing, I suppose, what I'm describing is the timing is quite good, quite helpful in that regard. Next, in terms of our people, as you go through the report, you can see that there's loads of information around various accolades and positive recognition that our staff have received across the board. One bit that I'd like to pick out in terms of how we're supporting our staff is item 5. Let's talk about race, which I think clearly indicates the efforts that we are taking to address the inclusion agenda and other bits and pieces such as freedom to speak up and Dear Peter, which again is described within the report, also go to that agenda around inclusion. Next, I mentioned innovation at the start, and great that we are relaunching, so not launching, but relaunching our Innovation Nation initiative. I think it was really well received previously when we ran the programme. It's a fantastic opportunity for people to come together, share ideas, evolve those ideas, so provides a springboard to people and those bright ideas that come in. And of course, what better way to do Innovation Nation than through a digital platform? Makes a lot of sense, doesn't it? So I'm really pleased that we've got that relaunch on the way. And then last but by no means least, service user and carer linkages. So item 9 describes the work that we are doing through predominantly Jonathan's office and chief operating officers across the system to prepare for whatever winter may bring us. COVID-19 clearly is still very much around and upon us. Albeit that initial emergency phase we've now moved beyond, but the challenges that winter will bring, we absolutely need to be planning for and planning for worst case scenarios. So Jonathan is working hard with the other directors of operations, chief operating officers across the system to produce good quality winter plans. Predominantly our support for the system is around enabling additional capacity for decant, for transfer of patients out of acute and through to home. But of course, we should also be absolutely aware of the prevalence of mental health conditions linked through to COVID-19. And in that regard, we're doing an awful lot of work through our performance team, our analytics team, to be able to predict that specific element of the impact of COVID-19. And the other bit I'd mention in terms of improving the quality of services and care to our service users and carers is perhaps within item 8, the system update. So I'm delighted to say that progress continues to go well in terms of our development to become an integrated care system as a whole across Staffordshire, but more specifically a provider of integrated local services at what we term place level. And for ourselves, that's North Staffordshire. And for those that maybe aren't that familiar with the agenda, that essentially becomes our footprint at North Staffordshire Combined Healthcare. So that relationship, improving the quality of relationship between ourselves, local authorities, other health and care providers, and of course parties like third sector, is progressing really well. Chris, I'll drop a name in there. Chris Bird, our director of strategy, has now been given the opportunity to lead at executive level that ICP, Integrated Care Partnership agenda across the whole of Staffordshire, so not just the northern ICP. So myself, Chris, and partners will over the next month or so both be submitting to the centre at a national level our plans around ICP development, but also evolve those through partners within the council. Really pleased with progress to date and the fact that Chris is now in that senior role across the system. And I do genuinely believe that ICP integrated care partnership agenda will significantly improve relationships across health and social care. And of course, we've got items on the agenda in a moment that we'll perhaps talk about in detail that maybe talk a little about the challenges historically that we've had around those relationships with health and social care, and the fact that we're maybe not where we need to be right here, right now. So the ICP agenda for me gives us a huge opportunity to improve relationships, remove cracks that exist, no doubt exist across health and social care right here, right now, and ensure that fundamentally we provide a seamless service users and carers across North Staffordshire. Okay, that's all I wanted to mention, David, but happy to take any questions or comments as usual.